Hold on to your hats, folks, because Kenya's healthcare system is getting a makeover. The winds of change are blowing through the corridors of hospitals and clinics across the nation. It's a time of transformation, a time of hope, and perhaps a bit of uncertainty. The government is swapping out the old National Hospital Insurance Fund for a shiny new model, the Social Health Insurance Authority. This isn't just a name change, it's a complete overhaul aimed at addressing the inefficiencies and gaps that have plagued the system for years. The NHIF has been a lifeline for many, but it has also been criticized for its limitations and bureaucratic hurdles. The goal? To provide affordable, accessible healthcare for everyone. Imagine a system where every Kenyan, regardless of their economic status, can walk into a healthcare facility and receive the care they need without worrying about the cost. It's an ambitious vision, one that promises to bridge the gap between urban and rural healthcare services, ensuring that no one is left behind. Sounds great in theory, right? But as with any sweeping reform, there are bound to be challenges. Change is never easy, and the road to a better healthcare system is paved with obstacles. There are questions about funding, implementation, and the readiness of healthcare facilities to adapt to the new system. But as with any major overhaul, the devil is in the details. The success of this new system hinges on meticulous planning and execution. Policymakers and healthcare administrators are working tirelessly to iron out the kinks, but there are still many unknowns. How will the transition be managed? What measures are in place to ensure that the quality of care is not compromised during this period of change? And in this case, the details are about as clear as a glass of muddy water. Patients and healthcare workers alike are grappling with the complexities of the new system. There are concerns about the continuity of care, the clarity of new policies, and the overall impact on the healthcare experience. It's a time of uncertainty, but also a time of potential. The hope is that with time and effort, the Social Health Insurance Authority will usher in a new era of healthcare in Kenya, one that truly serves the needs of its people. Let's face it, the NHIF was starting to resemble your grandpa's car Reliable, but in dire need of an upgrade. For years it served as the primary health insurance provider, but it struggled to keep up with the growing population and rising healthcare costs. Coverage was limited, reimbursements were slow, and let's not even get started on the bureaucracy. Something had to change. Enter the SHA, promising to revolutionize healthcare in Kenya. The new system aims to provide universal health coverage, ensuring everyone has access to quality care without financial hardship. It's a lofty goal, and on paper the SHA has some impressive features: wider coverage, more comprehensive benefits, and a focus on preventative care. But the big question remains: can it deliver on its promises? The transition from NHIF to SHA hasn't been exactly smooth sailing. In fact, it's been more like a roller coaster ride through a thunderstorm. Patients have been automatically enrolled in the new system without their knowledge or consent. Imagine their surprise when they show up at the hospital expecting their trusty NHIF card to work, only to be told they're now part of this newfangled SHA thing. Confusion reigns supreme. One of the biggest complaints about the transition has been the lack of clear communication. Patients are left in the dark, unsure of what steps to take next. They sit in waiting rooms, their faces etched with confusion and frustration, trying to make sense of the medical documents in front of them. The transition was supposed to make things easier, but for many, it has only added layers of complexity. The government has done a less than stellar job of explaining the changes to the public. Press conferences and official statements have been filled with jargon and technical terms that the average person struggles to understand. Instead of clarity, these announcements have often led to more questions than answers. The officials seem out of touch with the real concerns of the people they are supposed to serve. What are the new benefits? This is a question on everyone's mind. The pamphlets and brochures handed out are filled with promises of better care and more comprehensive coverage, but the details are murky. Patients are left wondering what exactly these benefits entail and how they can take advantage of them. The lack of clear, straightforward information is a major barrier. How do I access care? This simple question has become a source of anxiety for many. Navigating the new system is like trying to find your way through a maze. Websites are not user-friendly, and helplines are often busy or unhelpful. Patients are left to figure things out on their own, leading to missed appointments and delayed treatments. Will I have to pay more? Financial concerns are at the forefront of everyone's mind. With the new changes, there is a lot of uncertainty about costs. Patients are worried that they will be hit with unexpected bills or that their out-of-pocket expenses will skyrocket. This financial anxiety adds another layer of stress to an already confusing situation. These are just some of the questions swirling around like lost tourists in Times Square. The lack of clear communication has left people feeling disoriented and overwhelmed. They are searching for answers but finding only more confusion. The chaotic rollout of the new system has turned what should have been a smooth transition into a nightmare for many. The lack of information has created fear, uncertainty, and a whole lot of frustration. Community meetings are filled with worried voices, and clinics are seeing an increase in patients who are not just seeking medical care, but also answers. The trust in the system is eroding, and people are feeling more isolated and helpless than ever before. The need for clear, compassionate communication has never been more urgent. Even if the SHA had the best intentions in the world, and we're not saying they don't, there's another major obstacle: Kenya's healthcare infrastructure. Many hospitals and clinics are already stretched thin, struggling to cope with existing demand. Now, with the potential influx of newly insured patients thanks to the SHA, the system is at risk of being overwhelmed. It's like trying to fit a whole herd of elephants onto a tiny rowboat. Another major concern is the lack of transparency surrounding the SHA. How is the new system being funded? How are decisions being made? Who's benefiting, and who's being left behind? These are all valid questions that deserve clear and concise answers. The government needs to be upfront and accountable to the Kenyan people, not operate in a shroud of secrecy. A seat at the table, engaging stakeholders. To get this right, the government needs to stop acting like a lone wolf and start collaborating with key stakeholders: doctors, nurses, hospital administrators, patient advocacy groups. These are the folks on the front lines dealing with the realities of the healthcare system every day. Their insights and experiences are invaluable in shaping a system that actually works. Learning from mistakes, a chance to course correct. Look, nobody's expecting perfection right out of the gate. Rolling out a new healthcare system is a massive undertaking, and there are bound to be hiccups along the way. The important thing is to learn from these mistakes and make adjustments as needed. The government needs to be willing to listen to feedback, address concerns, and be flexible in its approach. The road ahead, navigating Kenya's healthcare future. The transition to the SHA is a work in progress, and it's too early to say whether it will ultimately succeed or fail. The SHA, or Strategic Health Authority, aims to streamline healthcare services, improve efficiency, and ensure that resources are allocated where they are most needed. This ambitious initiative is designed to address the long-standing issues within Kenya's healthcare system, such as inadequate infrastructure, shortage of medical personnel, and limited access to essential services, especially in rural areas. The potential is there to create a more equitable and effective healthcare system for all Kenyans. By focusing on preventive care, enhancing medical training programs, and investing in modern medical technologies, the SHA could revolutionize the way healthcare is delivered in Kenya. Community health outreach programs are also playing a crucial role in educating the public about health and wellness, thereby reducing the burden on hospitals and clinics. These programs are essential in promoting healthy lifestyles and early detection of diseases, which can significantly improve health outcomes. But it will require a concerted effort from the government, healthcare providers, and the public to overcome the challenges and ensure that everyone has access to the care they need. The government must commit to sustained funding and policy support, while healthcare providers need to embrace new practices and technologies. Public participation is equally important, as community involvement and feedback can help shape a healthcare system that truly meets the needs of its people. Collaboration and communication among all stakeholders will be key to navigating the complexities of this transition and achieving a brighter, healthier future for Kenya. A call to action, making healthcare work for everyone. This isn't just a job for the government, it's a collective responsibility. Citizens need to stay informed, make their voices heard, and hold their leaders accountable. Demand transparency, demand accountability, and demand a healthcare system that puts people first. After all, access to quality healthcare shouldn't be a privilege, it's a fundamental human right.